Hello, I'm Natasha Schoeler. I'm a dietitian at Evelina London Children's Hospital and Senior Research Fellow at UCL Great Ormond Street Institute of Child Health. My specialist area, both from a clinical and research point of view, is ketogenic diets, predominantly as a treatment for drug-resistant epilepsy, but it does expand to other conditions as well. Now, ketogenic diets are a group of very high-fat, low carbohydrate, moderate protein diets, very highly controlled, not really anything like the keto diets that you see people talking about on social media. And I wanted to share one story about how my research and research that I've been involved in has helped change clinical practice and impacted patients and families. Now, ketogenic diets is not a new treatment option at all for epilepsy. It was first sort of published upon as a medical treatment back in the 1920s. However, historically, people seem to be quite reticent about using it for infants, understandably. I'm speaking about infants with epilepsy here, because they're a very vulnerable population, right? And over the decades, there has been some, not randomized controlled trial, but some level of evidence showing that it's safe and showing that it works, and in fact can be particularly beneficial for this age group. But we didn't, prior to a couple of years ago, have any high quality controlled trial evidence showing that. So in collaboration with Professor Helen Cross, who is a consultant paediatric neurologist at my institution, at UCL Great Ormond Street Institute of Child Health and Great Ormond Street, we conducted a multi-center national randomized controlled trial looking at the evidence of ketogenic diets versus sort of care as usual, which in this case was a further anti-seizure medicine, looking to see whether it was safe, how effective it was in this age group, so under 2s in our case. And we showed it to be a safe and tolerable treatment, and we showed both treatment groups to be effective as well, which is great. And so we've contributed, let's say, to the evidence base in a positive way, giving pediatric neurologists confidence that they can use ketogenic diet as one of the treatment options for these individuals. However, what was my favorite thing, the favorite outcome, let's say, from the trial was the increased awareness of ketogenic diet amongst the wider community, for example, pediatricians with an interest in neurology, of the suitability of ketogenic diets for infants with epilepsy. Because we did a national survey via the Ketogenic Dietitians Research Network, which is something that I set up some years ago. We did a survey of practice back in 2012, I want to say, and then we did another one a couple of years ago, and we showed that the proportion of infants who had been referred for epilepsy in the UK doubled. So it went from 10% of referrals to 20% of referrals. Now, of course, we can't 100% attribute this purely to the trial, but because we had a lot of, if not almost all of the ketogenic centres in the UK involved in the trial, so it was a topic of conversation amongst the ketogenic community in the UK, it must have played a major role. And so I'm really happy and proud to have been a part of that, to hopefully allow more children or infants and their families the opportunity to at least explore this treatment option for them.